Hello and welcome to Restorative Health Care. My name is Tamie Yost and I'm here talking with Dr. Heather Wisniewski.
Hi everybody.
I have a question today. What is NET?
NET is Neuro Emotional Technique. It was developed by Dr. Scott Walker, who is currently still here and present and doing research along with several others in the NET community in regards to the actual technique.
And how does it work?
It basically works on utilizing the body to find emotional complexes that are preventing us from having optimal health, that are preventing us from moving forward in life, preventing us from getting healthy into our most optimal potential.
If I were to come in to do NET work, what would I experience?
The experience is unique and generally has to do with actually deciding whether or not we're going in with a mind entry because you've come in and something is causing you a headache, you've had stress at work, there's a lot of high emotion and you're feeling a lot of tension in your back, versus a chronic back pain kind of thing and entering through the back pain. Both are ways of accessing the emotions that are preventing healing or preventing someone from having a headache.
Now this isn't something like you'd need to do blood work or anything, would it?
Absolutely not. Some of the research, though, behind NET does and has done blood work. What they actually did was they took blood work before, during, and after NET treatments and were able to prove that there was a shift in a good direction of our cytokines and interleukins.
Okay, and what are cytokines and interleukins?
Cytokines and interleukins are our anti-inflammatory and inflammatory factors of the body, which Dr. Candace Pert of MIT, a PhD biochemist, has proven that are also the composition of our emotions, which ties in the mind-body connection.
So it's basically just emotions and not invasive?
Not at all.
Okay. You'd mentioned that if I had like some back pain that could help me. Does it help with chronic pain?
Absolutely. It's actually what the actual technique was originally used for and started, and what some of the starting of it happened was with chronic back pain. Basically, when you have chronic back pain, usually there's a lot of emotion behind it. There may have been a major trauma, there may have been a major injury, or just the length of time of having the pain can create emotion that keeps your inflammatory factors high, fueling and giving gas to that chronic pain.
So clear the emotion, clear the pain.
Absolutely.
Okay. And what would I need to do before I came in to have my first NET session?
I require that people actually have a brochure and read on NET, as well as I encourage them to go to the website www.netmindbody.com, netmindbody.com. In that you'll find a patient area. If you go into the patient area, you can actually view and see an actual NET treatment.
So I'd have some idea of what I was coming in for.
Correct. And the other thing is that I really emphasize, and so does the educational material, that we're dealing with emotional reality. In other words, what you and I see at a scene of an accident are going to be completely different because our emotions are different. And so we are not dealing in a factual reality or trying to find things out. This is not investigative. It is not looking into the future. It is basically strictly working on an emotional reality that we have developed.
Okay. Well, if anybody is intrigued by the idea of trying NET, please give us a call here at Restorative Health Care, and we'd be happy to find you a time to schedule an appointment with Dr. Heather.
Have a great, happy, healthy day.